In this video, I'm going to teach you how to do a very powerful exercise for treating your neck pain. But it doesn't just stop with neck pain. If you're having pain in your upper trapezius, in your shoulder blade region, pain down into the arm and elbow and even into the forearm, any of those places are fair game with this exercise. It's very powerful. This exercise seems to be especially effective for people who spend a lot of time with their heads in flexion. That means their heads downward, looking downward. So, if this is you, sitting at work, 8 hours, sitting at work, 8 hours, or this, the incidence of neck pain is 10 to 20% per year and more common in people who work desk jobs and in students. Or this,
I'm going to be late for dinner and my neck hurts.
Or if you're in all of these positions for a lot of the day, this exercise might be just what you've been looking for to get rid of your pain. I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsboro. And in this video, I'm going to teach you how to do an exercise called Sustained Cervical Retraction and Extension in Prone. I get it, not the sexiest name of an exercise that you've ever heard, but as I said in the introduction, it's very effective for those of us who spend lots of time looking down with our necks in flexion, because we're putting our necks and heads in the exact opposite position for a sustained period of time, thus undoing all of those flexion forces we're having throughout the day. Let's start the exercise. Sustained cervical retraction and extension in prone lying. Here's the setup. We're going to lay on our stomachs. We're going to have our elbows right below our shoulders. Rest your chin gently on clasped fingers. You're going to look down at a 45-degree angle. That's just to get the neck joints in the proper orientation for this exercise. Then we're going to retract our head and neck as far as we can backward. The best description I've heard for the retraction motion is imagine somebody coming in to kiss you that you don't want to kiss you, and so you just kind of pull away. Maintaining the gaze downward at a 45-degree angle, we retract as far as we can, then we look up as high as we can, point our fingers upward as if we're praying, and then rest your chin on your fingertips. Initially, I might hold this for around 15 seconds because it is pretty intense. And if it feels okay, then we're going to proceed. If it feels really intense and uncomfortable or painful, stop, rest, try it again for another 15 seconds. If it's still uncomfortable, this is not the right exercise for you. If it starts to feel better, or if it causes some discomfort, but when you're done, you're not feeling any worse, good. Proceed with caution. If you're feeling great after doing it, by all means, go for it. Here we go again. Now we'll do it a little longer. Say we did 15 seconds, feels pretty good, or a little uncomfortable, but we're not any worse. Let's go for it. We'll hold it for the prescribed amount of time. So once again, resting the chin on clasped fingers, looking downward at a 45-degree angle, retract my head and my neck as far as I can, then I look up as high as I can, point my fingers, and rest my chin on the fingertips. And you just relax into the position. As I relax into this position, I feel a pretty strong stretch in my lower neck and even my upper back. To me, it feels really good. If you do this and you start to feel pain getting worse in your upper back or going down farther into your arm or something like that, that's a sign that this is maybe too intense for you and I wouldn't do it. I go to one of the other exercises that I've posted in previous videos. If you do this and it starts to feel better and looser, by all means, continue. If you do this, it produces a little pain, but when you get done, you're no worse, then proceed with caution. Once again, gaze downward, 45-degree angle, retract backward as far as we can, look up as high as you can, rest the chin on the fingertips, hold 30 to 60 seconds. What I often do with my patients is I'll have them do a set for 30 to 60 seconds, rest for maybe 15 seconds on their clasped hands like this, and then do another set. So you're going to do 2 sets of 30 to 60 seconds. That's often what I have my patients do. I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsboro, showing you how to do sustained cervical retraction and extension in prone. The dosing for this exercise is maintaining the position for 30 to 60 seconds every 2 to 3 hours or as needed for pain. If you do this exercise and you're pain-free or feeling a lot better for 4 hours, then do it every 3 hours. If you do the exercise and you're pain-free for 2 hours, then do it every hour. But stick to this dosing that is appropriate for you, and in a matter of days, maybe up to a week, you're going to feel better for longer periods of time. When that starts happening, you can do the exercise less frequently. Stick to it for a full week or two, and by that time, your symptoms might fully be abolished. Once that happens, you might just do the exercise once a day, or go to my personal favorite exercise for the neck, which is called cervical retraction and extension in sitting, and you might just do 10 to 15 repetitions of that one every day. Always try these exercises out. So if you do the exercise, get up, move your head around and your neck around. Does it feel better? Do you have a larger range of motion? Are you moving more fully and more freely? If so, that's a very good indicator that this exercise is going to do wonders for you. If you do the exercise and you feel worse, meaning you maybe feel more stiff, you have pain that's more intense in the arm or in the upper back, then I would back off and try one of the other exercises I've showed in previous videos. If you like what you've seen in this video, make sure to subscribe to our YouTube channel and then click on the little bell so that you'll be notified each time we upload a new video showing you how to do one of these powerful exercises. Leave comments below letting us know if you've tried the exercise and how it worked for you. If it worked for you, let us know how. If it didn't work for you, let us know that, because if it doesn't work for you, we can give you suggestions on how to modify this exercise to make it more beneficial to you, or we can suggest another exercise that might be more appropriate for you.